day, everyone. My name is Dr. Falake Omonogun. I'm a registrar family medicine, Iye Mission Hospital, Ogide, Anambra State. I'll be talking on the topic hypertension. Hypertension is defined as elevated blood pressure. That means the pressure in your blood vessel is high. So when you measure your blood pressure and you get a reading above 138 millimeters of mercury, that denotes hypertension. What are the symptoms of hypertension? There are different symptoms of hypertension, which include headache, moderate to severe headache, poor sleep, chest pain, palpitations, and so on and so forth. So, when you have these symptoms, it may denote that you are hypertensive. But even if you don't have these symptoms, it doesn't rule out that you are also hypertensive because we have what is called asymptomatic. Someone can be hypertensive and asymptomatic. That means the person is not manifesting any symptom. So please note that. So what are the different causes of hypertension? Age. With increasing age, the chances of having high blood pressure also increases. Race. It is known that hypertensive is common among black people. Family history is also one of the causes. If you have a family history of hypertension, the chances of getting high blood pressure is high. Obesity, that is unhealthy weight gain, it can also predispose an individual to hypertension. Unhealthy lifestyle such as smoking is also a risk factor, one of the causes. Unhealthy diets such as taking high fatty food, high salty and spiced food, fast food, canned, frozen, and processed foods, they all can predispose an individual to hypertension. Stress is also one of the causes. So, what are the complications of hypertension? So, hypertension can lead to the following condition if it is not well managed or controlled. They are heart disease, heart failure, stroke, and even death. So, how do you prevent hypertension? There are different ways of preventing hypertension. One of it is what? Monitoring your blood pressure regularly. So you can do yourself a favor by walking into any hospital around you. You can also do what to come to ENO Mission Hospital at Ogidi, Anambra State to have your blood pressure checked because it has to be checked accurately also. So from there, it will help you to uh, do what is necessary as regards your health. The other preventive ways you can employ to prevent hypertension is managing stress. Stress management is key in preventing hypertension. Then you must keep a healthy gain, shed weight, excess weight, shed it, exercise regularly, eat healthy diets like low sodium or low spice food, then healthy lifestyle like exercising regularly. You also need it, it will help you. Then eradicating sedentary lifestyle, it will also help you. Then limit your alcohol intake, it will also help you prevent hypertension. Another thing I would also like to tell you is that if you are hypertensive, please, you are to continue to take your drugs until your doctor says otherwise. I've come across many patients, once they are diagnosed hypertensive, they tell you that they had to stop after taking the antihypertensive for some time, maybe 2 weeks or a month, when they discovered that their blood pressure was normal. It was those drugs that you were giving that kept your blood pressure, that kept it normal. So you are not to discontinue it until your doctor says otherwise. So that is first thing. Then the second thing I also want to say is that if you have any unpleasant side effects from any of the drugs prescribed to you to control your high blood pressure, please communicate with your doctors. Don't just discontinue it. Go to your doctor, let your doctor may change it to another one or even discontinue it, but please let it be done by your doctor. The another thing is that if you have been diagnosed hypertensive, you will need to come to the hospital for checkup, for follow-up. So it's not a one-time thing. We want to see how well you are responding to those drugs that you were placed on. We want to be sure that those drugs are not bringing your blood pressure too low, because that one is another problem. So all of these things you must also take note of. Thank you, Dr. Falake Omonugun, Registrar Family Medicine for Mission Hospital, Ogidi, Anambra State.